the exciting dimensions to his position. Warm welcome, Dr. Robert Stewart.
Hi, it's great to be here. It feels like we are in the centre of technology being here in Kent, and I'm really pleased that Kent has got the ambition to really take technology forward. I'm quite breathless really, because I met Shirley earlier, and she's already told me various things that I've got to do in my life, and I'm going to do them by the end of today. So really we're on a roll here. So she wanted me to just quickly explain my role. I'm a GP. But I've been given a really exciting opportunity with KCC to be what's called a clinical design director, and that's bringing clinical context and leadership to KCC as a council, to the Health and Wellbeing Board, but also to enhance the dialogue, the clinical dialogue with clinical commissioning groups, the new commissioning arena that's been put forward where local people can, and GPs and other people can actually contribute to the commissioning of care. So I can do that as well as trying to lead KCC into the wider arena around Europe. So a lot of these things are very exciting, and it's a really good time for me and for Kent County Council. So why are we here today? Well, I believe we're here because there's a new revolution. So revolution is in the air. And the revolution has already happened, but unfortunately it missed the NHS in particular, because it didn't realise that actually now it's not about the nanny state, it's actually about the citizen. Actually, the citizen has now access to information that they never had before, and actually the citizen often has access, even people who don't have smartphones, etc., they have access to smartphones through their relatives, carers, or whatever. So actually the revolution has happened. Unfortunately, the NHS quite often uses yesterday's technology tomorrow. We want them to use today's technology today, and perhaps even tomorrow's technology today, if we can get to there. So why are we trying to do this? Well, we're trying to get the citizen to be at the centre of things and actually start to take much more of an engaging role in terms of determining what sort of care they need, but using technology to do this in a new way so that we can really get them to be empowered, so that we can move from this medically dominated model of care, which should still have the medical input, but actually helping the citizen to have much more empowered self-care, which is supported. So I think that this is all about inclusion. It's about trying to make sure that we redefine what a community is, for example. I was at a meeting earlier this week and we were trying to define the community, and of course, as a GP, I know what the community is. It's all the people in my practice. But perhaps all the people in my practice don't think it's their community. And in fact, when I was talking to somebody, he said he was a biker, and his community is the community of bikers. And I said to him, rather flippantly, well, that's fine when you're fit. He said, well, actually, we've got one guy who can't bike anymore. He lives 100 miles away, but we always tell him where we're going, what we've done, and he feels included in our community. So let's broaden our ideas of communities. Let's also try and do things that other people haven't done. So rather sadly, one of my patients said, oh, Dr. Stewart, I've got a recurrence of my breast cancer. And I said, oh, that's really sad. She said, don't worry, they're going to have a multidisciplinary team meeting about me. And then she said, but the trouble is they won't let me be part of this multidisciplinary team meeting, because I don't seem to be very important in this picture. But that's where the revolution needs to change. We need to become much more 24/7, we need to be much more instantaneous, and we all need to be on Twitter. Thank you, Shirley. So how do we do all of those things? Well, I know an example in the room of somebody who actually has only got 10 beds in his hospice, but by using 10 laptops, he's doubled the size of his hospice. And now people can have hospice care in their own home. They can contact the hospice whenever they have a problem, and the hospice will respond to their needs as if they were in one of the beds in their hospice. And I just think that this is the sort of way that we can actually use technology to actually move from people being shut away and put in their own homes, having difficulty getting out, and we can actually then really try and transfer the whole way and the decision making. If the relative was able to know what the care plan was, then they would be able to say whether this was the right care or the wrong care, and some of the stuff that came out of the Francis report would have been overtaken. So, I know I'd love to talk to you for a bit longer, but actually I know that there's a lot to be learned from today. I think it's a great programme, got some great speakers, And what I really want to see is that everybody really believes that for once we truly put the citizen at the centre. Thank you.